name is Karina, and I'm a health analyst, and I am located in Memphis, Tennessee. I'm here because I believe it's imperative we start the conversation about mental health and to equip people with the knowledge. I'd like to say thank you for being here, and thank you to Dream Launch for giving us this platform.
All right, so I do have a follow-up question. The issue of substance abuse has come up several times, and we were just talking on the side chat. You know, a lot of us, some of us on the call, we will have a drink because we didn't think it was a problem to have a drink every day. And like, I think that a lot of us are using this as kind of a coping mechanism and not recognizing that. Do any of you have any thoughts on that? And what should we do? I mean, you can't really exercise like you want to. Like, the alternative is to go to the gym. Nope, can't do that. You know, so you're here all day, you're tied to this computer for whatever reason, and then you have a beer that's not in my screen. So how are we supposed to approach that, and how are you guys approaching that?
If I could be honest, I did not actually notice that this was a day-to-day activity, happy hours and getting on Zoom calls and having drinks with your friends, until one day I was like, I think I should take a day off. Then I was able to sleep, and it was just like, wow, I think I have had a drink almost every day. And I never ever associated myself with having a drinking problem or that being an issue, but we are normalizing this in this new normal. And so how do we make that part of the conversation as well?
Well, I think you're making it part of the conversation by starting to become self-aware of it. So I think the first thing is just becoming self-aware of what you're actually drinking. And that doesn't even have to do just specifically with alcohol. I look at it as, we talk about eating well, you have to think about drinking well, because our habits are so different that there are things that you have access to, unless you're like some high-level lawyer that keeps, you know, high-end scotch or whiskey in your office because that's the thing to do. You're not typically going to have alcohol around you your entire work day. And I think now it's your home. So not only are we snacking, people are sipping on things because they're home, they're stressed. So becoming more cognizant of when, you know, how much you're drinking, when you're drinking, what kind of things are you drinking? Are you making an effort to make sure you're drinking water? Because you most likely won't be sipping on some scissor or something if you are drinking water. And be mindful of your tea or coffee, and then things that are heavy sugary drinks. So that's the other thing. This is a time where people can drink a bunch of soda. If you're in the South, a bunch of sweet tea, and nobody wants COVID pre-diabetes. So it's becoming cognizant of what you're bringing in your body as a liquid and as food. And I think a lot of times we end up talking about what you're eating and what your quarantine snacks are, but not necessarily what people's quarantine drinks are.
Travis, to better battle the idleness of our minds, can you talk about the importance of staying active, whether it's exercise, walking, running, gardening, any activities?
I mean, it's very important, but what I'm learning both for myself and for all the people I treat is it's really a test of creativity. I think one of our biggest challenges now with so many people at home or working from home is that we have too much convenience. Like we mentioned, the drinking, it's right there. Many of us in our normal day-to-day lives are too busy to make it to happy hour, so we miss it. And that in itself, our busyness limits our alcohol drinking because we're not done at work to meet with our friends at the bar or whatever, so we just go home because we're tired. But now we have all this convenience around us, right? And the convenience would have you sit, eat, drink, and watch TV all day. So often what I challenge my patients to do thus far is I ask them, what do they want to walk away from this current quarantine saying they accomplished, or behaviors that they built around? And what they've been telling me is, oh, well, I just have to accept that I can't go to the gym, and I'm going to sign up for this trial membership of online workouts, or I'm going to actually, instead of just putting together whatever, I'm actually going to plan nights that I'm going to cook something and actually put time into it. And sort of having something that they can actually put their time and energy to that they plan to is helping them feel less cooped up, because something that they're already going to do feels more like an actual activity because they plan to make this 2-course meal versus just putting together what's in the fridge. And it sort of takes some of their mental energy, gives them something to focus on. I've had patients actually get back to reading books that are on their shelves that they've never gotten into, instead of just sort of aimlessly browsing online, looking at tutorials of things they've wanted to learn to do, whether that's gardening that you can do from your kitchen window to knitting to other things like that. So challenging people to be, and challenging ourselves to be creative and mindful about how we spend our time, respective of the limitations that we have right now.
Have you seen an uptick in crime or disputes with involving children or even adults that's different from pre-COVID times?
Yeah, so we're seeing like one of the things like Dr. Vieux mentioned before, we're seeing a lot more kids who are coming in with, whether it's bruising or, and obviously you can see some domestic violence. The stories usually don't necessarily add up with regards to their injuries. And then, of course, with the lockdown, trying to get access to child protective services and those other services to, the child welfare agencies have been, more difficult. And those are usually, if you want to call them sort of safety nets, usually if we suspect something, we can reach out to them. They can go to the homes, but of course, we're limited at this point with regards to what those services, And then, of course, I think there may be a lot of other people who are not, or kids who are not presenting, just because the parents are not, unless it is some major injury. They're not going to present to the ER because they're associating the hospitals with having COVID. So that, so of course the numbers will be skewed. It's kind of hard to even fathom the amount of violence that may be out there ongoing with regards to kids, just because they're not showing up.
Okay. Dr. Vieux, can you speak on the emotional impact that a lot of our 2020 graduates are having with missing out on senior activities and graduation? I've noticed that there have been internet campaigns of everybody post your graduation pictures, and that may not be good for the kids who are actually missing out on these things. And I feel like we're all trying to come up with an easy fix instead of being empathetic. So can you talk on that a little bit?
That's a great point. And in fact, some medical schools have actually brought the graduation even earlier, so the graduating physicians can actually jump in and help the pandemic. I mean, NYU has actually offered doctors graduating early, and even in my program, our graduation is going to be virtual. So, and that's like a big deal when you think about, you're finally done with residency. This is the last time before you become before you become an attending, and it's going to be a virtual graduation. Again, it's very concerning, and I think the concept of not having a prom for high school students, and and not having the actual live graduation for college students, that's really a big deal. But even I've noticed that the biggest concern is what happens afterwards. So, for example, the high school student, when are they going to start school? So that's still kind of in limbo. So the aspect of not actually having a graduation, it's only part of the struggle that we're dealing with, because again, we're not sure when colleges will start again. I mean, some schools have actually talked about actually starting in spring 2021. So there's definitely like a lot of issues. Another issue that we're dealing with is, even when people are graduating, when are you going to actually start work? It's definitely it's uncharted territories that we're dealing with right now. And I think the key thing is for people to really be resilient and to kind of be patient. I do think this is one of the things that I'm concerned about. This is one of the things that I've done with the medical students that have graduated from medical school and are actually attending my program. I've actually reached out to them to actually start the dialogue, because one of my biggest concern is the fear of people becoming isolated. And, you know, again, kind of like what we were talking about, like the happy hour. If you become isolated, this is when it's very easy for you to fall into traps, whether it's alcoholism, whether it's not eating healthy, like, you know, and having all these negative thoughts. So I think one of the things that we do have to deal with these graduating classes, to make sure that we are still somehow able to keep them connected. Perfect examples that if you look at the Divine Nine, you look at fraternities, sororities, I think you've seen like a lot of alumni members actually reaching out to the graduating class, you know, reaching out to the undergrads, making sure that they're still connected somehow. So even though you may not be able to see them one-on-one, but the concept of like what we're doing right now, having these virtual meetings, it still maintains the bond.
What do you say to those people that have to be strong for other people, those leaders?
Well, one thing and it's funny because I was speaking to some fraternity brothers about this very, very, very topic, and a lot of these men, they find that they're in situations where they have to be strong for their families. They have to be strong for, you know, just the community in general. And my basic premise is that, yeah, be strong, but you need to understand your boundaries. That we're not superhuman, you know. And just being able to make sure that you maintain your boundaries, make sure that you're not necessarily an enabler of problematic behavior. And I think that if you maintain your boundaries, you wind up respecting yourself a lot more, and you also, you know, people wind up respecting you more as well. So I think the biggest thing, going back to what, you know, Corey said, is really that question that Corey asked is really understanding the concept of having boundaries and maintaining those boundaries.
Does anyone else have anything to add on that?
I have something to add. So I think it falls into a couple buckets. One bucket is when you're trying to be strong for your family. The other is when you're being strong as a leader in your business. And I think this is a place where, number one, it's important to have a core group of people that you can be vulnerable to and actually tell what your feelings are, be it your significant other if you have one, good friend, your business besties, whoever. Then you also need a tribe of folks that understand what's going on with you professionally, because especially being a leader or business owner, there are a lot of responsibilities you have with your decisions, especially during COVID, that someone that is not a business owner may not understand, as far as what your responsibilities are, balancing the safety of yourself and your staff versus feeling like your staff may not be eating if you close. What's going to happen with your business if you're doing something that the amount of income is shifting dramatically? And those are conversations at times that you need someone that is a colleague or peer that understands the logistics, not only to be an ear, but to help you problem solve through them. An example is if you don't have anybody in your crew to talk to about EIDL or PPP, you're going to be stressed trying to work through it. But if you have a tribe and you're like, hey, CARES Act came out, I'm trying to problem solve around it, and you work through it together, then I think there are some things that are going to be professional buckets of responsibility that you need a tribe that understands what you're doing professionally to work that through, which is very different than the strength and resilience you're dealing with your family, and then having people you can actually talk to about the feelings you have of everyone that's essential or is leaving the house. Especially, I know for a lot of physicians, there's a lot of concern about not only can I expose my patients or someone else if I get this, but also every time I go to work, I'm putting my family at risk, and the fear of what happens if you bring this home to your family, or the guilt people are having that they had a contact somewhere at work or somewhere unsuspected in a community, and then they have a family member that either gets sick or dies. That you just need a really good support system that you can actually be honest with your emotions with.
While we hope that hearing about mental health can be therapeutic and helpful, it is not a replacement for medical attention. At the end of the video, you will find a list of resources for mental health and anyone seeking professional care.